Dysphonia is simply hoarseness. It's any kind of problem you have with your voice. And there are hundreds of different reasons why you might be struggling with your voice. So the symptoms of dysphonia can be a very wide range, and they can be any kind of change in your voice from what you think is normal. So it can be rough, it can be breathy, it can be weak, it can be high-pitched or low-pitched. It can be painful in and around the throat, or it can be very, very dry in your throat. Any of these things can come together and give you dysphonia. So there are many, many different reasons why you will get dysphonia or a change in your voice. They can be generally categorized into some sort of inflammation. So you might have some acid reflux, or you might have a laryngitis. You can get neurological issues, like one of the vocal folds is not moving properly, like what we call a vocal fold palsy. You can get muscular tension, so a lot of tightness in and around your throat, which would cause everything to get very squeezed and you get very tight in the voice. And lastly, you get what's called anything which will give you a mass effect. And what I mean by that is that there's a lump on the vocal fold, and there are many different types: a cyst, a polyp, worst case scenario, even a small cancer on the vocal fold. All of these things can give you dysphonia. So when I see a patient with dysphonia, I take a full history, I do an examination with an endoscope, which passes so that I can look at the vocal folds and I can see exactly what's going on. Once I've got a diagnosis, that will lead me to determine what the right treatment is. It can be an entirely medical treatment, like pills for some sort of acid reflux. It can be more of a therapeutic type treatment, like speech therapy to change the way you're using your voice. Or it can even be a surgical treatment where I need to take out a cyst or a polyp on the vocal fold to try and get the normal anatomy. So professional voice users are very likely to get some sort of dysphonia at some point through their career. Just like an athlete is likely to get an injury at some point. So to try and avoid that, you have to do all the correct things with your voice, like an athlete does with their arms, their legs, their body. You're going to warm up. You're going to warm down. You're going to keep well hydrated. You're going to not eat late at night. So you're going to try and avoid any kind of acid reflux. You're going to avoid the particularly fatty or particularly spicy foods, all the good things in life. What you're going to do is treat yourself as a professional and look after yourself. What you also need is a good team around you. So you need to know where to come to find someone if you do have a voice problem. That's where I come in. You need to know where your vocal coach is. You need to know where a speech therapy is, or even a physiotherapy. You have a good team around you, and that will keep your voice going for as long as you want it to.